With its strong heritage, the Golden Shepherd makes for an excellent watchdog, service dog, and overall companion and friend. The Golden Shepherd is an eclectic mix between a Golden Retriever and a German Shepherd. Both breeds have a fascinating history. The Golden Retriever was originally bred in the Scottish Highlands as an exuberant gundog that would find and retrieve game. The German Shepherd descended from large German herding dogs in the 19th century. Its incredible combination of intelligence, athleticism, and speed has served all kinds of purposes, from police work to search and rescue. It was also used in both World Wars. The Golden Shepherd inherits attributes from both breeds, including the loyal and friendly personality, the muscular, athletic body, and the dense coat of medium to long fur. This coat can be rough like a German Shepherd or soft and smooth like the Golden Retriever. Despite the name of this hybrid, it actually comes in several colors, including black, white, gold, cream, blue, gray, tan, and sable. Despite being generally healthy, the Golden Shepherd always has the chance to inherit several health problems from its two parent breeds, including allergies, heart disease, cancer, epilepsy, eye conditions, and endocrine diseases like diabetes. Another potentially serious problem to look out for is von Willebrand's disease, a bleeding disorder that results from low levels of clotting protein in the blood. The dog is also prone to a developmental disorder called hip dysplasia, in which the hip doesn't form properly and regularly comes loose from the joint. Finally, owners need to be aware of bloating, a very serious condition that can cause the stomach to expand rapidly if the dog eats too quickly. Some of these conditions have a strong genetic component that can be minimized through good breeders, but problems will always arise, no matter how healthy the dog seems. In order to catch these problems early, it is always recommended to schedule regular checkups with your vet for tests and a physical examination. A healthy Golden Shepherd will usually have a lifespan of 10 to 14 years. In summation, these are the most common health problems of the Golden Shepherd. The Golden Shepherd has an outgoing, upbeat, and friendly personality that should get along well with almost everyone. There is a chance it may inherit a wariness of strangers from its German Shepherd parent. But once it makes friends, this dog is a loyal and protective companion and even an excellent watchdog. Sometimes they can be a little overprotective and will anxiously check up on each member of the family. This antsy and restless trait is another issue you will have to deal with. If left alone for too long or ignored by its owner, then the Golden Shepherd can become anxious and bored, which may lead to destructive and unwanted behavior. This is why owners should supply its dog with plenty of activities to do. As a result, this dog does best in larger homes with plenty of space to roam in. The Golden Shepherd is a medium to high maintenance dog. Since it requires a great deal of hard work and attention caring for, this dog does best with an experienced owner. However, even novice and first-time owners can learn how to take care of this dog with enough time and effort. If you have any other questions or concerns about your dog's care, then you should consult with your vet. A fully grown Golden Shepherd will probably need between 3 and 5 cups of high-quality dry food per day. The exact amount will depend on the dog's age, size, and activity level. If your dog is prone to bloating, then you might want to use a slow feeder bowl or divide up the meals into several per day. If the dog starts to show signs of allergic reactions or gastrointestinal symptoms, then you should adjust the diet and try to find a food that works. With its heavy and frequently shedding coat, the Golden Shepherd needs to be groomed with a simple pin brush around 2 to 3 times a week, although these brushing sessions may need to occur almost daily during the heavy shedding seasons of the spring and fall. The coat generally keeps clean and should only be bathed as necessary whenever the dog becomes particularly dirty. Proper dental hygiene should be maintained with simple dental chews and regular teeth brushings at least a few times a week. Finally, you should trim the nails with a clipper and clean the ears with cotton whenever necessary. The Golden Shepherd is a very trainable and eager-to-please dog that strives to obey all of its owner commands. It responds best to a firm and strong leader who employs a consistent and predictable training method. Owners should try to set consistent boundaries and rules for the dog to follow, and then communicate as clearly as possible when the dog is doing something wrong with a calm and dispassionate tone. It is not a good idea to act aggressively toward your dog. In fact, owners should strive to be positive and upbeat. Offer it plenty of treats and praise when it does something right. Fortunately, this dog isn't too stubborn or belligerent, and it grasps commands very quickly. If you are struggling to maintain a consistent process, then you might want to consider taking your dog to see a professional trainer. The Golden Shepherd is a highly active dog that requires at least 45 minutes of exercise per day. Otherwise, if it doesn't receive enough playtime, it might become bored and anxious. This dog will enjoy an adequate amount of long walks or runs on a leash, combined with the ability to roam freely in a large yard or park near your home. Indoors, you should have plenty of chew toys and balls available for it to play with. The Golden Shepherd also excels at all types of tricks, agility competitions, and sports. Golden Shepherd puppies need to be trained from an early age to prevent them from developing some bad antisocial tendencies as an adult. Owners should preferably start puppies on obedience training, house training, and, if necessary, crate training within the first 6 months of its life. Owners should also attend to the puppy's physical development. Their bodies may be sensitive to running and jumping until about 18 months of age, so you should limit their exercise at first to slow walks and playtime on soft surfaces.